Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
When you're outside this time of year, it's important to think about safety. It's even more important to think ahead.
If you're going to go out, have a good time, but know what you have for allergies. Someone that has a bee sting allergy should obviously always have their EpiPen with them. Depending on where you're going to go, what you're going to do, you should also be thinking ahead, what could I possibly have for injuries? It's nice to have a first aid kit with you. It's nice to be able to take care of yourself and your family members first.
When you're out hiking, biking, you have to know exactly where you are.
It's wonderful that we all have cell phones, and yes, we can get GPS off the cell phones, but you should know exactly where you are for best access. Just in case the emergency is more than you can handle on your own, when you call 911, we need to know where you are to be able to help you.
When building a first aid kit, it should be specifically tailored to your activity. However, there are some basics.
If you're going to go for a day hike, you obviously don't want to carry a backpack full of first aid supplies, but you should have some type of ability to stop bleeding. Obviously, the first aid kit that you have at your home is going to be more extensive than what you'd have if you were going to take something to the beach or on a day hike. Some of the really basic stuff, it still goes back to that stopping bleeding, bandaging. Then you might also want to expand with a pair of scissors. Tweezers, cosmetic tweezers work great for taking out bee stings or rosebush thorns. A simple space blanket you can pick up at a camping store oftentimes work well to keep people warm. And the last thing that I would really consider for a home kit is some type of baby aspirin.
It's also a good idea to check your first aid kit to make sure it hasn't been stuffed away for too long.
I would probably say every 6 months. But at least annually. And what you want to look for is just expiration dates. And you want to make sure that your Band-Aids are actually still reasonably clean and sterile, that the packages that they come in are sealed. So it's worth taking a look through and just making sure that you actually have the stuff that you need in that first aid kit.